The World Health Organization says the number of Ebola infections in West Africa has passed 20,000. Nearly 8,000 people have already died from the virus. Sierra Leone has been the hardest hit, along with Liberia and Guinea. Joining us now on the line from Geneva is Gregory Hartl from the World Health Organization. Thank you so much for speaking to us. 20,000 cases, nearly 8,000 deaths. Have we reached the peak of this epidemic, or is the worst still yet to come?
Well, what the 20,000 cases don't show is what's happening week on week. And that's actually more important than the total cumulative number of cases. So what we believe we are seeing, or starting to see now, is that the weekly number of cases is stable, if not indeed tapering off a little bit. So that's good news. It's very good news. But it's way too early to be happy about anything, because there are still many, many hotspots of activity in the three countries, and we really are going to have to work very hard in the next year or however long it takes in order to extinguish every single last case, because this outbreak will not be finished until we're down to zero.
So you say the number of cases, new cases, is stable for now. Why is that? Why are we not seeing them go downwards? Is it a case of behaviors not changing?
No, well, we actually think that probably, in Liberia, we think the number of cases is going down. In Sierra Leone, the cases in almost all the country are going down, except in the western area. And in the western area, as we know, a new focus of transmission has just started. So that, unfortunately, is a bit of a surge at the moment, and almost half the cases in Sierra Leone in the whole country are in the western area. So that really is a hot spot that we're working hard to contain, and as you might know, we've sent teams in there proactively a couple of weeks ago to build the Ebola treatment centers and to do door-to-door case finding in order to stop as much as possible the transmission and further augmentation of cases in that area.
We know a vaccine is in the works. How long do you expect until it's available? And do you think 2015 will be the year that Ebola is eradicated?
So we can't rely on vaccines. Vaccines are a misnomer, because we have no idea when and if a vaccine would be available, and we don't want to think that a vaccine is a silver bullet. What needs to be done is a series of bread and butter, almost public health measures, which we know work, and we see that when we can put into place the whole gamut of tools, that it works. For example, in Lofa County in Liberia, in Kenema, or in Kailahun in Sierra Leone, we have seen cases go down to zero. And that's what we need to do across the three countries. And we can't predict how long that will take, but we need a concerted effort to continue until we get to zero.
Thank you so much for speaking to us, Gregory. Gregory Hartl is spokesperson for the World Health Organization, joining us there on the line from Geneva.